Good afternoon, everyone. Thanks so much for joining us. We're going to wait a couple more moments as people join us, and we'll start right at 12. Feel free to introduce yourself and let us know where you're joining from, though, in the chat. Nice. Someone joining us all the way from Virginia Beach. All right, we are at 12 o'clock, and I want to respect everybody's time. Thank you all so much for joining us today. We are from the RAFT program. We'll tell you a little bit more about RAFT, but we're going to talk today about promoting safety at home and in the community for older adults living with dementia. So just a few housekeeping notes before we really get started here. All the participants will remain muted throughout the webinar. We do want to hear from you though, so please put comments, questions in the chat. If you haven't already, feel free to introduce yourself and let us know where you're joining from in the chat. We will be able to share the PowerPoint and the recording after the presentation as well. So we'll just go ahead and introduce our team. My name is Sydney. I am the RAFT Education and Outreach Coordinator. And Emma, do you want to introduce yourself?
Sure. Hi, everyone. My name is Emma. I am a dementia support specialist with the RAFT team. So I work with care partners and people with dementia in the community, doing education, training, and connecting folks to resources.
Thanks, Emma. And Bernicia, I'll let you introduce yourself and turn it over to you to talk about the clinical program.
Okay. Hello, everyone. My name is Bernicia Bell, and I'm one of the mental health therapists with the RAD program. And I work on the clinical side of the program, so I'll introduce you all to the clinical support program. Um, our program is a regional program. We were created 17 years ago. We provide support to older adults with who are seriously mental ill or who have dementia, who are diagnosed with dementia with challenging behaviors. We discharge older adults from the psychiatric hospitals and get them into a nursing home or assisted living within the Northern Virginia area and continue to provide supports to them. Currently, we have a 98% success rate with preventing individuals from going back into the psychiatric state hospitals. With our program, what we currently provide is we have contract facilities with different assisted livings and nursing programs in the area, and we continue to provide intense mental health services to the clients that reside there. We also provide on-site support, providing consultation and education to the staff that work at these nursing home and assisted livings. The criteria for our program is the individuals must be 65 and older. They are resident of one of the 5 counties, and they are diagnosed with a mental health diagnosis, a serious mental health diagnosis, or dementia with challenging behaviors. They're at risk for psychiatric hospitalization, or they're currently hospitalized, and they require ongoing treatment to manage their mental health issues. All our referrals are made through the local CSB. So if you have any questions or would want to ask about a possible referral, please contact the RAFT program for more information.
All right, I can share a little bit about the RAFT Dementia Support Program. So as Benicia said, the clinical program for RAFT has been around for quite a long time now, but there was still a need for folks that were staying in the community. So just about 3 years ago, we started the RAFT Dementia Support Program, which is supporting older adults with dementia and their caregivers that are still residing in the community. So this program is short-term, generally working with families for about 2 to 3 months with the goal of connecting them to long-term support services and creating a plan for the future. And the program is completely free. So generally, we have trained dementia specialists. Emma is one of them who will work one-on-one with families, come right out to the home, assess what some of those challenges or concerns might be, and then provide education and resources based on those challenges. Working to connect them to lots of different resources and services in the community, along with their caregivers and family. And then we also have the ability to provide free respite care in an assisted living facility. So this is the eligibility for that program if you are in Northern Virginia. We can serve folks in any of those 5 counties. They have to be 55 years or older, have a diagnosis of dementia or symptoms of dementia. We can work with them for up to 60 days without that diagnosis. And they do need to be living in the community. So that means in their own homes, the homes of a family member or caregiver. This program would not be open to folks that are in an assisted living facility or a nursing home setting. And a little bit different here than the clinical program. The referrals for this program can really come from anyone. So we often get referrals directly from families. They can also come from social workers and hospitals. We do have an online form that folks can fill out. And if for whatever reason that form is not accessible, they can go ahead and give me a call directly. I'll go through that process over the phone. And then in addition to all of those services directly with clients, both teams provide free consultations to professionals and families in the area. Often those are virtual, but happy to do those in person sometimes as well. And we also do free training. So like this webinar, we can also do trainings that are more personalized and specialized to your groups. All right. So Emma, do you want to talk about the need for safety precautions?
Yeah, definitely. So, we'll be focusing on ways to make the home more safe for folks living with dementia. Just a quick overview of dementia. So, dementia is a big umbrella term for a variety of different diseases that have to do with something damaging the brain. All dementias are progressive. So, over time, the symptoms will increase, and then they're also chronic. So, when someone has a diagnosis of dementia, they're going to have that diagnosis for the rest of their life. Um, Generally, someone with dementia is experiencing a loss of cognitive functioning. So that means difficulty with things like thinking, remembering, stuff to do with executive functioning, like planning, making decisions. Some people, especially over time, start to have difficulty with like their movement and mobility. So really, um, it becomes so important to make sure someone with dementia is safe because they're experiencing symptoms like a lack of judgment, not being able to decide or make informed decisions about their safety. Some people become like less aware of what they need to do to keep themselves safe. Folks can experience changes in their vision, so making it hard to like identify objects or changes in their motor skills, which can result in increased fall risk. Um, Other folks will have trouble sometimes identifying the use of an object. So, for example, they might pick up a toothbrush and think that it's a pen, or vice versa. And then there's also the component of aggression. So some folks with dementia will develop more agitated or aggressive behaviors, stemming from that increased confusion. Um, and some folks don't realize that they have dementia. So when you might try to redirect or take something away from them, they don't understand why you're doing that because they don't feel like there's anything wrong with them. So all of these kind of symptoms that are happening can lead to increased safety concerns inside and outside the home. So this is also a big question too, right? We want to keep our loved ones safe, but we also want to respect the fact that they are adults and to help preserve independence as long as possible, right? Because dementia is a progressive disease. So over time, they're going to need more and more help. But especially in the beginning, it's really important to kind of maintain skills as long as possible. So it's always a balancing act of like, okay, my loved one still wants to cook, or my loved one still wants to, shower independently. What am I going to do to kind of support that, but also make sure that they're safe? So it's always kind of a balancing act of balancing that autonomy and also balancing safety. A big question we get often is it safe to leave my loved one home alone? Or is it safe for my loved one to still be living independently? That's a big question. And it's a big transition for people who have been living alone. And a big consideration too, if you are, for example, working full time and not able to provide that full time care, making that decision for, okay, does my loved one need to move to a more supportive environment? Or do I need to get more help in the home? What would that look like? So, some questions to help you kind of reflect on this issue. Does your loved one become confused or unpredictable under stress? Would they recognize a dangerous situation? For example, if they left the stove on and there was a fire, would they recognize that this is a dangerous situation and they need to do something? Do they know how to use the telephone in an emergency and to dial 911? Do they know how to get help? Like, find a neighbor, call a family member or friend, call 911, leave the house if there's a fire, things like that. Do they stay content within the home, or are they prone to wanting to leave the home and wander? Is it a concern that if your loved one's home alone, that they might leave the home for a walk and then not be able to find their way back? Do they show signs of agitation, depression, or withdrawal when left alone for any period of time? So is it like they need the support of someone there providing companionship to be with them so that they can maintain a good mental health? And do they ever attempt to pursue former interests or hobbies that might now warrant supervision? Do they want to cook or repair something or woodwork? Another consideration too, are they a smoker and would they know how to like put out a cigarette and not just leave it there? These kind of considerations can really help you make a decision about, is it safe for my loved one to be home alone? So general home safety tips. Uh, some big ones for all of us, not just if we're caring for someone with dementia, but especially so. Make sure your carbon monoxide and smoke detectors and fire extinguishers are available and inspected regularly. Replace those batteries twice a year. I guess the consideration of daylight savings time too is important as well. Consider securing large furniture like bookshelves, cabinets, large TVs to prevent tipping. I know when you go to like IKEA and stuff, often they come with like the protective like latches and straps to keep things secure to the wall. Um, Another thing too is to consider removing firearms from the home or storing them in a locked cabinet. Um, which can be hard for like someone who might have had like a past interest in like hunting, for example. Um, but these can be a big danger. So it's definitely important to consider like, do we need to either get rid of or lock away firearms? And then avoid the risk of over or underdosing by supporting individuals with medication management. So that can look like stepping in to help manage your loved one's medication. That can look like, setting up their pill containers, and maybe they're able to kind of follow along and do it themselves. That can also look like some pharmacies, or I think Amazon does it through PillPack, where you order their medication already in like little packages that are dated, so all their medication is in one place. Or it could look like, for example, getting home care to come in and having a nurse kind of set up the medication. Um, so that's important too. And then fall risks. This is huge, especially for someone who might be using a walker, who might start kind of shuffling and being unsteady on their feet, um, who's experiencing changes in their vision. And also certain types of dementia, like Lewy body dementia, a hallmark of it is a higher fall risk because of the way that their brain is being impacted and how it's impacting their mobility skills. So, big one, removing tripping hazards like throw rugs, extension cords, and excessive clutter. It's easy to get those things underfoot and to trip. Keeping walkways and rooms well lit. Folks with dementia actually need like a lot more light to be able to see. So even in a room that might seem pretty well lit to you, it might be too dark for your loved one. Um, when they're sitting, try to encourage them to sit in chairs that have armrests or provide support so they can't slip out. Um, Put carpet on the stairs or mark the edges of steps with brightly colored tape. So someone who's experiencing vision changes in their kind of depth perception can be really easy to not be able to distinguish between stairs. So like marking with like some bright red electric tape can help them distinguish between each staircase and reduce the risk of falling. Um, if falling down the stairs is a big problem, maybe consider getting a gate and trying to redirect the person away from the stairs. Clean up spills right away because those are easy to slip on. Small pets can also easily get underfoot too, so that's something to consider as well. Um, if your loved one is like getting up in the night to use the restroom, automatic night lights or night lights are really helpful so that they can see better while they're walking. Another thing to consider too is if you're noticing that your loved one is a lot more unsteady on their feet, always good to check in with a doctor. It could be a change in symptoms, it could also be an effect of medication that they might be taking. And then Sydney put in the chat the Northern Virginia Falls Prevention Alliance, but you can get connected with one of these programs. There are different exercise mobility programs that are provided in like senior centers, community centers, that help people learn skills to prevent falls or help build their strength and balance. So definitely worth looking into.
You can also teach folks how to fall safely, which is
Oh,
important
yes.
as well.
All right, so we talked about how dementia can impact someone's vision, someone's ability to make decisions, to be aware of safety. So these are some material changes you can make in the household to ensure safety. So we've got some cleaning materials, and then we got grape juice, and you can see they're like fun, bright colors. Pine Sol and Welch's grape juice look very similar in color. So someone who might not be able to read the label anymore or understand the label anymore might see something like that and think it's like grape soda, juice, and they're thirsty and they might try to drink it. So we don't want that happening. So we want to try and keep all cleaning products like laundry pods that can look like candy, bleach, cleaning supplies that look like juices, out of sight or secured. I know a lot of folks will like keep them under their sink. So thinking about like, do you need to put a lock on it? Do you need to change where they are just to prevent this from happening? You also want to consider keeping the number of poison control handy or saved in your phone. If you need to call poison control, I'll put this in the chat too. So the national line that's toll free is 1-800-222-12222, and they'll connect you to your local poison control. But being really careful. Something that you wouldn't personally eat, you don't know if your loved one might be confused and try to eat it themselves. So keep that stuff out of their reach. Safety in the kitchen. So part of this is making changes to prevent them from hurting themselves. But also part of this is, again, coming back to that like autonomy safety discussion. So if your loved one has been cooking all their life, or, like all of us, if we're hungry, we can just go into the fridge and get what we want to eat. For someone with dementia, they're still an adult. They've lived a life before this. They still have the urges to get a snack or to cook their own food. So, in addition to these safety measures, you also have to think about like how can I support my loved one in doing this safely? It's not enough to prevent them from doing something because that urge is still there. How can we redirect into a way that's safer for them to pursue these interests and needs, which could look like cooking together, delegating a safer kitchen task to them, having safe snacks that are more visible and accessible, things like that. So safety in the kitchen, especially for someone who wants to use the kitchen and might be alone at times. Consider having appliances that have an auto shut off feature. Consider disconnecting the garbage disposal. It could be easy to like mistake that switch with the light switch. Label the hot water faucets. So red, you could do it with colors, red for the hot, blue for the cold. That kind of automatically connects with our associations with those colors, or write hot and cold. So your loved one doesn't mix them up and accidentally scald themselves. Replacing kettles that might have gone on the stove instead with electric ones that have an automatic shut off. Signs can be really helpful. Putting them near appliances that get hot, like an oven, a toaster, an iron, that say like stop, don't touch, very hot. Um, Keeping them invisible, but not so close to the appliance that they could catch on fire. Let's see. There's also things that you can get online that are like little boxes. They're like automatic voice reminders. You can record your voice. So I've seen someone like keep it next to the microwave as a reminder to like don't put metal in the microwave, or as a reminder like to turn off the stove. That can be helpful depending on where the person is at in their progression. And again, thinking like if someone wants to make tea, that's not a big issue, but they need supervision. So encouraging them to do it with you or keeping an eye on them and stepping in to make sure that they're not using appliances when alone, perhaps unplugging the appliances when they're not in use. There are all types of cabinet locks. Um, so again, you can get stuff to prevent them from entering, like, where you're keeping the cleaning supplies, where you keep the knives, things like that. Various different types depending on your cabinets, depending on like what's works for your situation. They've got the U-shaped locks that go over like the poles, the ones with the magnets that open up, they're a little less like visible. Um, and then there's some other options too. So you could consider getting a lock on the fridge or putting locks on appliances. Again, something to consider is that if your loved one wants to get a snack and they see a lock, that might not necessarily prevent them from you know, trying to open the door. So I've had like a client who had put locks on the cabinets and then their loved one ripped the cabinet door off of the frame. So something to think about too is that there needs to be a redirection. If they can't be cooking, then perhaps they need to have accessible snacks out, or you need to be meeting the need to cook together, like asking them to do a safer kitchen task while you're cooking dinner. Because if the need is still there and the thing is locked, they're going to be frustrated, understandably. Knives, that's a big one. So you can get like in drawer kind of lock boxes for knives. You can also consider like putting them higher up in the pantry so that they're not visible, putting them in a locked cabinet. It's harder for you to access the things you need, but more importantly, it's harder for your loved one. If someone's experiencing paranoia, anxiety, who might not be able to distinguish between like visual or auditory hallucinations, understandably, they might want to protect themselves. We don't want any accidents happening, so I do really recommend keeping knives away from people. Safety in the stove. So there's a few ways that you can disable a stove or keep it safe. I would say the cheapest and one of the easiest ways, if your stove is kind of set up this way, is that you can get knob covers that prevent them from being turned on and off. Um, you can remove the knobs too. Of course, sometimes it'll leave like a little pokey bit, so that's another safety concern. So I think the knob covers are one of the best ways to go. You can turn off the gas if you have a gas stove. Usually, like the shut-off valve is behind the stove. It could be like in the drawer underneath or underneath the stove. It is a little finicky, like kind of a pain to have to turn the gas on and off, but it is an option for sure. And then there's devices that you can install that are automatic stove shut off devices. So these are like, you can set it for a timer. I saw one that's like Wi-Fi connected and will turn off if you leave the stove. Um, this is a good option for someone who's like in a stage where they can still cook, but maybe can't keep track of time. So if they're like making soup or making tea, they might get distracted, step away, and then hope, a fire could happen. So these things can be helpful. They can be quite expensive, like a couple $100s. So the stove knob covers might be a better option. But this is for sure something that exists. Safety in the bathroom. So bathroom falls are quite common. Usually you're in like a pretty tight space. You take a shower, it's gets all humid and wet and it's easy to slip. Um, so thinking about how to make a bathroom accessible for someone with dementia. One is installing grab bars for the shower or the tub or the toilet so they can hold on to something when they're getting in and out. You can go to your hot water heater if possible, if you have access to that, and set the temperature to a max of 120 degrees or less to prevent chances of scalding. Um, Fall risks are really a big concern, so you can apply those textured stickers to like the slippery surface of the tub to prevent that from happening. Other things exist like shower chairs, so your loved one can sit while they're showering. Toilet chairs that go above the toilet so they don't have to sit down as far. Or some people will just replace the toilets with a higher toilet, so again, they don't have to struggle to sit down. Labeling water faucets, again, hot and cold, can be very helpful. Reminder signs can be really helpful too. So keeping in mind, we want them to be dementia friendly. So having like simple pictures, large font, having contrast, and then keeping them in space that makes sense. For example, if you're reminding your loved one how to use the toilet, how to wipe and all that stuff, you probably want like the sign like across from them while they're sitting on the toilet. Or if it's about washing their hands, having it like on the mirror or by the sink so they can be reminded of how to do these things. Again, shampoo, conditioner, body wash, all that stuff, consider labeling it in big font so they know what is what. Or keep out of sight and bring out when they're needing to shower and do all that stuff. Again, to prevent the risk of ingestion. Safety in the garage or the basement. So, big thing, limiting access to equipment like lawnmowers, weed trimmers, snow blowers. Maybe they can still use them, but maybe supervision is needed at this point. I had a client who like loved to blow the leaves around. It brought him such joy. So it was unrealistic to say like he can't have it anymore. He just needed someone to be there with him to kind of supervise and help him out. Again, keeping those poisonous chemicals, gasoline, paint thinner, paint out of reach. Somewhere hidden. You can cover them up with like a black sheet. You can put them on a highest shelf. Move them somewhere else where they're not accessible. Just to prevent that risk of ingestion. Locking and properly storing ladders when not in use to prevent tripping or climbing hazard. Again, thinking about how vision is impacted. Marking stairs with like brightly colored tape so they can see as they're going downstairs. Making sure the railings are sturdy. And again, just trying to keep the area pretty open to avoid fall risks. Another consideration too is if there's just like too much stuff in the garage or the basement that is a risk, maybe that door needs to be locked off.
All right, so we are going to transition now to talking more about safety in the community. I didn't see any questions in the chat, but if you do have any questions for us throughout, please put them in there, and we'll make sure that we get to all of them at the end. So we're going to talk more about driving safety, which is a big conversation for many, many families of when is it time to stop driving? How do I have that conversation with my loved one? And what does that look like? So you might not know, there might be some big signs that someone needs to stop driving, but it's not always super clear when that needs to happen. It generally doesn't happen, the moment someone gets a dementia diagnosis, they don't have to stop driving. So what are some of the things to look for? One, if they're having trouble paying attention, they're not noticing traffic signs, they're maybe making errors at intersections, turning, right from the left lane, not necessarily making sound judgments. Maybe they're following too closely, they're having trouble merging, they're hitting the curb, so some of that trouble with vision is coming up, or delayed reaction time. So maybe they're noticing the traffic light, but their ability to brake quickly, especially if they're in traffic, is a little bit delayed. If they're having issues with directions, so maybe they're still actually driving okay, but they're not able to safely make it somewhere because they're having trouble finding their way. One of the big things that happens with dementia is we have a hard time wayfinding or retracing our steps. So someone might have a harder time getting somewhere that they haven't been before, or someplace that's not as familiar. I was recently actually talking with a family, and they were deciding on whether or not this was the time to stop driving. And they shared that their loved one, if he was listening to his GPS and if it said turn right, he would understand that, but it would take him a moment to process. So he wouldn't turn right away at the street that they wanted him to. He would turn right at the next street because of that delayed processing time. So he was often getting lost. It can be really helpful also to look for patterns and maybe even keep a log, because we all have bad days. I've hit a curb or two. I'm not going to stop driving necessarily soon, but we want to look for those patterns, and figure out if things are getting worse, and it might be time to start having that conversation. So, first off, having this conversation about taking away the car keys can be really challenging. For some folks, it can be easy, but most of the time, this is a hard conversation. It's a big loss of independence for folks, especially if they're not necessarily recognizing that they're having some of these challenges. We know that a lot of people with dementia don't necessarily recognize, or see that they're having those challenges. So we want to recognize that lack of independence that's going to happen with not driving. So trying to plan for alternatives right off the bat, whether that's friends or family, getting them connected to rideshare programs, volunteer services, maybe through the villages, or connecting them with public transport that's accessible. We start having the conversation with them. Again, that conversation might go well, it might not, but really being respectful and understanding how hard and challenging this might be for them, that they aren't necessarily going to recognize the challenges that they're having, and then this can just be a very upsetting conversation. So we might need to enlist doctors into that conversation. We've actually seen folks who get a prescription for not driving anymore. So if your loved one is somewhat of a rule follower, that can be really helpful. You can connect them with the DMV, so the DMV can do an actual driving test and let them know that they're actually not able to drive anymore. And all of those are great, again, if you have somebody who's going to remember those conversations and will follow the rules. But we know there's some folks who they're still going to dismiss that. They're still going to want to drive. So then what does that look like? We've seen folks who actually will remove the car from the driveway or the garage. This can be a good option because there's not that visual signal of the car anymore, reminding them that they should drive. However, we do know that that might cause some folks to believe that their car has been stolen. And then they're experiencing kind of paranoia and suspiciousness about that. Another thing you can do is keep the car there, but disable it. So disabling its engine, or doing whatever you have to do in cars. I am not a car person in that way. So it's still there, but maybe doesn't run, or taking the keys away physically or replacing them with keys that don't work. We also generally encourage somewhat of a therapeutic or little white lie. People have very different levels of comfortability with this, but this might be saying, the car is in the shop right now, or there's something wrong with the car, we have to get it fixed. we'll bring it back. So that might be something that is workable as well. And Emma has been putting a lot of information in the chat about driving, and it looks like Officer Turpin as well of how to recommend someone to the DMV that they might need to stop driving. So thank you so much for that. All right. Even if someone is no longer driving and they're just a passenger, there can still be some safety concerns. So I've heard of family members who say, my loved one will try to open the door while we're driving. So it's really hard to take them anywhere. They might unbuckle their seatbelts. So it can be helpful if you're having trouble like this, having someone in the back seat, because you can actually put the child locks on the back seat when it's not as easy in the front seat. All right. Oh, and Emma, do you want to share what you just posted in the chat? 'Cause I think that's a really good point.
Oh, sure. So sometimes people with dementia, a lot of times, they don't believe that they have dementia. This isn't because they're in denial. This is a symptom of dementia. It's called anosognosia. Basically, it's forgetting that they forget. They might have the diagnosis, they might have talked to the doctor multiple times about this, and they still don't think they have dementia. So if the conversation is started like, Mom, you have dementia, you can't drive anymore, you might get, I don't have dementia, don't tell me what to do. In those cases, it's good to have a conversation about other reasons why they might not want to drive. For example, if you live in Northern Virginia, traffic is absolutely terrible. I have a few clients who just don't want to drive because it's scary. So you could say like, Mom, traffic is so bad. I know you hate it. Well, I know this like transportation service. What if you did this instead so you don't have to worry about traffic? Or gas is so expensive. Wouldn't it be nice if you had a little pocket change if you weren't spending it on gas? Or, your vision's changing, your hearing's different, like other reasons to justify not driving. Or you can connect to like other motivations. For example, if your loved ones wants to help others, you could say like, we can donate your car, or you can give it to your grandson. He just learned how to drive. I'm sure he would really love a car. Or connect to their sense of justice and safety. Like, we don't want to get into an accident. We don't want to hurt anyone. We want to make sure everything's safe. Like other reasons why they might not stop driving if they're not receptive to the idea that they have dementia.
Thank you, Emma. That was perfect. All right. So transitioning to talking about wandering. Wandering is a big challenge that a lot of our clients face. And about 6 in 10 people with dementia will wander at least once. So when we talk about wandering, there are a lot of different types of wandering. Some people are really headed out somewhere specific. They might feel like they need to pick their kids up from school. They might feel like they're heading to work. I used to volunteer at an assisted living, and a woman, she was always trying to leave so she could go home and make her husband dinner, always around about 5 o'clock. Other people might not necessarily be headed anywhere specific in their minds. They're just looking to move their body, right? Maybe they don't even realize they're headed outside, or they just want some exercise. It's a beautiful day out there. The leaves are changing, and they're heading for a walk, but maybe it's not safe for them to do so alone because they're not able to find their way back home. So there are a lot of different things that we can think of in terms of preventing wandering. One, kind of validating if they're talking about wanting to go home, wanting to see their children, validating those needs and the emotions behind that, not necessarily. Now, they don't need to be picked up from school, but really coming into their reality and maybe redirecting them. ABC charts are a tool that we often help families with in terms of tracking behavior. So if your loved one is wandering consistently or trying to leave consistently, that the tools of ABC, the B is the behaviors. The behavior is going to be wandering. The A is the antecedent or the trigger. So maybe we notice mom is always wandering or trying to leave the house right after she takes her medications, or right around 5 o'clock, because that's maybe when she would have headed home from work. So trying to figure out, what's happening right before that behavior. And then what's the consequence, the C? What are some of the ways that we've worked to redirect her that have worked really well and maybe haven't worked really well? That's a good tool to try to figure out, what strategies are going to work and maybe aren't working. Signs on the door. So signs like keep out, don't go in here. Those can work pretty well to redirect folks. Again, you have to know your loved one though. If you have somebody who's not necessarily a rule follower previously in life, a sign that says keep out is probably not going to keep them out still. So knowing them can be really helpful. And then just keeping them engaged in daily routines and activities is a great way to prevent wandering. But then there's also environmental modifications, and we're going to talk more about all of these. The one thing we want to keep in mind is we're never working to actually lock someone into their home. We don't want situations where someone is left home alone and a door lock is put in place, because that's obviously a huge safety risk. All of these things are meant to basically slow someone down so the caregiver or family member is able to intervene and redirect. So there are different types of door alarms, ones that can be put over the door, ones that can be put on the door handle. Sometimes they will have like big blasting noise that will sort of scare the person away from opening the door. Sometimes they'll be quieter and will just signal something to the caregiver, sometimes on their phone, to let them know that the loved one has opened the door, maybe in the middle of the night, and they need to get up and redirect them back home. Similar to the stove covers, the stove knob covers that Emma talked about, there's things that you can put over the doorknob, which will make it a bit harder to get out the door. You can also put murals, nothing fancy. They're often pretty cheap online, over the door. So it looks like in this picture, a bookcase. Of course, someone who's in the earlier stages, that's probably not going to deter them. They're going to know that that door is behind there. But for someone maybe a little bit more advanced, who's starting to have issues with depth perception, this might actually seem like a bookcase to them. And then without that visual reminder of the door, they're less likely to go out. These are just some other types of door locks. Again, the goal of the door locks is not to lock them inside, because that's a huge safety issue, fire risk, but just slow them down to just make it a little bit harder. If your loved one is at risk for wandering, if you think this might happen, it's really important to be prepared. So, just letting neighbors or friends know, folks on your street, hey, mom likes to go for walks. Sometimes she gets a little lost. If you notice her walking, would you mind giving me a call or redirecting her back home? ID bracelets or necklaces are great. Tracking devices, which we're going to talk a little bit more about. Having a recent photograph of your loved one, because if there is a situation where you do need to talk with the police, they're going to need that recent photograph of them. And then also think about possible potential destinations. Again, for the people that are just getting out and trying to exercise, they might not have a specific destination, but other folks we might know, they're trying to head to 7-Eleven, or they are, trying to go to the bus stop. I worked with a woman for a long time who was always trying to pack her bags and head to the bus stop so she could get to work. So when she never wandered, but I know that if she got out, that is for sure where we would have looked for her if she had exited the building. So Emma's put in a lot of great resources in the chat. I'm going to talk about tracking devices a little bit, and then Emma, I'll have you share anything you have as well. So there are applications you can put on your smartphone. Again, this depends on if your loved one is still using their phone and having it on them regularly. If they do, though, these can be good options. Project Lifesaver is a program That is in Northern Virginia through the different county sheriff's departments, where they will have a record of your loved one that they might be a wander or elopement risk, and they'll have a different bracelet either on their wrist or on their anklet that will actually have a tracking device on there, so it's easier for folks to be found. Apple AirTags can be a good fit, although I believe that there is a distance at which they don't work if they're too far from an iPhone, so keeping that in mind. TileMate is another tracking device. Angel Sense, smartwatches. So if your loved one is open to wearing a smartwatch, most of them have a tracking feature. And there's also GPS. It's called GPS Smart Sole. So it's actually an insert that can go into the shoe. That is a tracking device. Again, you'll have to think about, is my loved one, if they are wondering, are they going out with shoes? And are they always wearing the same shoes? Because that could be a challenge. So Emma, do you want to share some of the things that you put in the chat as well?
Yeah, so the one thing is there are a lot of GPS trackers. A lot of them now, they kind of work on you buy it and then there's a subscription fee, so that's something to consider. Things like AirTags and Tiles, they have a smaller radius, but they are cheaper. You do need to have a smartphone to use them. Thinking about like what is your loved one willing to wear? So if your dad has never worn a necklace in his life, he's probably not going to wear a necklace tracker. Maybe he'll wear a wristband one that looks like a watch. Um, Project Lifesaver is really great because you do connect with the sheriff's office. They are like ankle monitors though, so they're very visible. So it might not be good for someone who would like recognize that they're wearing it and try and take it off. In those cases, you can try like the tile and the air tags and like connect it to a zipper on a jacket or like just put it in the shoe, things like that. Um, there are ways to kind of keep them a little bit obscured, so that they're less likely to take it off. Um, at like the least, I guess, kind of thing that you can do is to make sure they're wearing some kind of medical alert bracelet. The HeroLink one, like it's tappable and they'll pull up all their demographic information. So at the very least, having their information on them, if someone finds them, they know who they are, they know that they have dementia, and then they know who to call and where they live. Um, that's like, you can print it off the computer, put it in a lanyard, put it in their wallet, and then, try and have that on them. But a tracker is really important for someone who likes to leave the house, and it can mean a matter of life and death. So, a really important thing to consider.
Thank you, Emma. Emma, as I mentioned, is one of our dementia specialists. So she's the one having these conversations every single day with families. So thank you for adding all of that, Emma.
Ooh,
Oh, go ahead.
I'm sorry. You can also, so I've had people who will not wear anything at all. You can get little tags that can be ironed into their shirts or ironed onto their shirts that like says their information. You can get medic alert tags that like go onto their shoelace. Like there's really small stuff, like a lot of creative stuff that exists to make sure that they have something on them. Yeah, sorry.
No, that's perfect. And I think the big point with all of this is that it's really going to be different for every single person. Everyone is going to need somewhat of a different intervention. So if you have someone in your life, or you're working with someone, we're happy to help brainstorm. There's a lot of different resources out there, and it's sometimes just about finding the right fit. All right, so as we end out, we're going to talk about some more abstract forms of safety, a little bit about financial safety, and then Bernice is going to end with talking about emotional safety. So financial safety is a very important thing. A lot of times we're working with folks who've lost a significant amount of money to scams or fraud or exploitation. This can, of course, happen from people that they know, friends, family members, and then stranger scams. So I think we're all kind of targeted by scams nowadays. They're calling all of our phones. But with someone with dementia who is losing some of that judgment, some of that safety awareness, they might be unfortunately losing money to scams that are a little bit less sophisticated, and not necessarily even realizing it. So these are some ways to help keep someone safe financially. You can add generally a trusted contact to bank accounts. So I really like this option for folks. It's not, putting them on the bank account, maybe for the family member who we don't necessarily want them on the joint account, but they can help monitor. So they might be able to say, hey, mom, I noticed that you're suddenly giving a lot of money to this group that we don't know about. Can you tell me more about that? And they can notice some of that suspicious activity. Signing up to receive notifications of large charges or withdrawals, again, for the family member or maybe power of attorney to get those notifications to check in then with their loved one. Putting spending limits on credit cards so they still have that independence of having the card in their wallet, but then there's some spending limits on there. You can also create maybe a separate account and have just a debit card that has a very limited amount of money in the wallet. So again, they still have an independence, but there's not the risk of them sharing out the credit card with the huge credit line. Signing up for the do not call list, which I used to do lots of presentations about scams, and people would always tell me this one doesn't work. And the challenge is that do not call list is for legitimate companies that are trying to sell you something. If someone is a criminal scammer, they're not going to follow the do not call list rule. So it helps somewhat, but it's not necessarily going to stop all of those scams. If someone potentially is at risk for missing payments on their bills, maybe they're having trouble keeping track of all those due dates, setting them up for auto pay, and then just helping them monitor those credit card statements and bank statements, making sure there's nothing on there that shouldn't be. And then that might let you know, all right, maybe my loved one isn't able to manage this completely on their own anymore, and let you know when it's time to step in. You can also opt out of transfers from the bank, so it's a little bit harder to move that money around for folks. It's not on here, but you can also freeze your credit, so someone is not able to take out a line of credit, which, if you know your loved one is not going to be buying a car or buying a house anytime soon, they probably don't need that open, so that's a good insurance method. And then I will turn it over to Renicia to close us out.
So, with emotional safety, a lot of times when we think about individuals with dementia, we often focus on the physical risks, such as falls and the wandering we talked about earlier, but emotional safety is just as important. So, with this quote from Tifa Snow, it's a powerful reminder that dignity isn't about cognition. It's about how we treat people. Emotional safety is when we protect that dignity, when we respond with patience, respect, and compassion. We're saying to individuals, you still matter, you're still you. So, with emotional safety, we'll start with social connection. Staying connected to others is very important. It helps to reduce isolation, and it helps people feel more grounded. So, it's important that people stay connected, whether it be by phone calls, by a lot of times now we can do, nowadays we can do video calls and things of that nature. Um, Having a sense of structure, that's important because it makes things predictable. Having those predictable routines, like having meals at a certain time and things like that, taking their meds at a certain time, that all helps kind of reduce any confusion or anxiety that individuals may experience. And also self-worth. Individuals with dementia still need to feel useful and appreciated. And with coping skills may look a little bit different for individuals with dementia, but you can help engage them in things like breathing exercises or listening to music, doing some physical exercises, or a lot of times using like sensory tools and things like that. are important. I know a lot of times some individuals may use like the little activity boards and things like that. So with addressing mental health concerns, a lot of times with individuals with dementia, we tend not to think about the mental health concerns, but they still need to be addressed. Um, Therapy and counseling, that may also be something that's a little bit different and may not be your traditional therapy and counseling, but it can be using techniques like validation therapy to help people feel heard and still connected. Using art therapy, what they may not be able to express through words, they can express through a um, creative means, through drawing, through painting, doing different collages. And also this can help with anxiety and help them to remain, help them with staying calm and things like that. And music therapy is very important. A lot of times that kind of listen to different music can spark different positive memories. I don't know if anybody has seen the YouTube video where the it was a lady with dementia who used to be a ballerina, and they played the music and she started like dancing to it and everything like that. So a lot of times using music and things like that can promote those positive memories from the past. So and then faith and spirituality, um, having those practices in place, whether it be through prayer, through music, and things like that, that helps them to feel more grounded and everything. So these are some additional resources in addition to all the resources that Emma has put within the chat. These are some additional resources that you can look further into as well. And thank you all so much for coming. If you have any questions, please feel free to put them in the chat so we can discuss that more.
Thank you so much, Bernice. I'm looking in the chat here. I don't think there's any questions. There were a couple, and Emma covered them with all the links and information. Someone had asked about if the PowerPoint will be shared. We will be sending that out to everyone registered, as well as the recording.
If you have any questions, you can always reach out to the email too. I'm happy to give you some ideas, talk through some things.
And as we said, we do free consultations, so always happy to do that with whether you're a professional, a community member, family member, or loved one. So thank you all so much. Have a wonderful rest of your day. Happy Halloween. And we'll see you for the next event. Take care.